Toronto Star. I'm Raju Mudhar, and this matters. There's an old saying that a society is best judged by how it treats its prisoners. During this COVID-19 pandemic, jails and other correctional institutions are a potential hotspot for outbreaks due to close quarters and overcrowding. That said, up until very recently, it was a prevailing belief to many experts that inmates were safer on the inside than out. In fact, that was one of the things being told to the inmates of the Ontario Correctional Institute in Brampton, which currently has the largest outbreak of a prison facility in this province. The Star has learned that 80 of 109 inmates have tested positive for COVID-19, as well as 21 correctional officers who worked there. To discuss this today on the larger issues facing correctional institutions, we will be joined by Alyshah Hasham, the Star's courts reporter who has been following this story. But first, we're going to talk with Derrick Peachey, who just served the last 10 months of his sentence for narcotics trafficking at the Ontario Correctional Institute. He was released in early April and tells us what it was like inside. Derrick, thank you so much for being with us.
Thank you for having me.
Can you talk a little bit about your living conditions? So in terms of, did you have one cellmate? What were the living conditions like? And then also, when news about the virus came, did things start to change at all? Like, did they start giving people masks and stuff?
Yeah, so OCI is a really unique environment because it's more like a treatment center than it is a detention center. And it's dorm-style sleep arrangements. So you're in a dorm, there's no cells, there's no bars, none of the doors are locked. So you're in close contact with everybody. So in every dorm, there's up to 6-7 guys. There's lots of interaction between you and other people. When they started making changes, they slowly implemented them. First, they stopped doing volunteer-run programs. So any volunteer from the community that used to come in to do like programs like Narcotics Anonymous weren't allowed to come into the facility. And then they canceled visits with family. So slowly, they just sort of took away everything that made OCI a good place to be.
What about, I only know stuff about prisons from the movies. So I assume that, did you guys all eat together? What about stuff like the gym, exercise and stuff like that? How was that affected? Were you still able to do that?
So what's interesting about that is I left on April 6th. And as of then, the only thing they shut down was the weight pit. And the only reason they did that was to save on cleaning supplies. As for everything else in the gym, playing basketball, close contact sports, it all continued right up until I left. And even the staff even got involved in some of the games. So it was kind of interesting because I know that outside of that environment, all the parks and basketball courts and everything were closed. That was something that they didn't, for whatever reason, decided to just keep going with. As far as the meals, the first thing they did with that, because we all do eat together, and there's 4 different units, and we go one at a time. Each unit goes, but we mingle. So at first, they took away 2 chairs from each table. There's 4 chairs at each table, and they only wanted 2 people sitting at each table. But then, like a week later, they put the chairs back, and they weren't really doing much as far as sanitation. When somebody got up from a table, they didn't wipe it down or anything. So it was actually, that was a really bad place for touching surfaces that other people have touched, or you know what I mean?
You were told by the nurses that you were safer on the inside than out in the regular world. How do you feel about that?
Yeah, I was really blown away when the nurse came and told us that we don't have to worry, we're in a controlled environment. I really didn't understand what she meant by that. Sure, it's in a controlled environment as far as we're not going anywhere, but there are still people coming in from the outside, like the staff every day. In my experience talking to staff, there was staff that wanted to wear personal protection equipment, even like of their own, and they were told that they couldn't. Yes, we were protected, but we're protected in the sense that we're just not out in the community. That's it.
I mean, the other thing is that I believe you're talking to one of our other reporters, and he said that another inmate started wearing the disposable gloves they'd been using to clean the cafeteria, and they were told to stop or be sent to segregation. Tell me that story, please.
He was actually in the cafeteria eating a meal, and he was wearing the disposable gloves. And when he got up to leave, he got pulled out of the cafeteria by a few guards, and he was told to take the gloves off, and he refused. And they told him if he didn't take the gloves off, that he would be sent to segregation. So I guess he took them off, and that was it. But they were trying to stop any of the residents there from wearing them because they didn't, again, I think they said they didn't want to create panic or whatever, right? I know the guy that actually had to take the gloves off, he felt better wearing them. So
obviously there's a lot of confusion that was going on around here, so maybe that fueled the decisions. But I think one of the most interesting things is that just as you're about to be released, you're going to go live with a friend. Your friend had some concerns. It says that you asked about being tested, and then you also asked for masks for the train ride to where you were going. What happened with that? And what the answer you got was?
I asked for an N95 mask. I actually put in a request for one. If you want something in there, you got to write out a written request. So which I did, and I thought it was a reasonable request considering I was leaving there and I was going to be taking public transportation. Now, in my mind at that time, the mask I would thought would protect me from other people being on the trains and stuff. But, in hindsight now, knowing what I know, like I could have very well left there with the infection and thinking about going on the GO train and then to Union Station. I could have affected a lot of people if I'm sick, right? So yeah, they denied my request. Yeah, that was that. No reason for it either. So instead of giving me an N95 mask, they gave me a naloxone kit. And that's for if you overdose on opiates.
Obviously, that's an important thing for another problem, but still, okay. Not in this one, I guess. Now, here's the thing. On April 17th is when we were notified that the 3 guards have tested positive. What did you hear from public health then?
I get a call on my cell phone from Peel Public Health. And all they told me was that I have to check my email. And I asked them, what's it regarding? And they said, check your email. We can't talk about it. And that was it. They hung up the phone. So I checked my email, and there was an email from Peel Public Health saying it was an email that was addressed to staff of OCI, not me as an inmate. And it said that I may have come into contact with somebody that has COVID if I was there between the dates of March 27th and April 19th. So I left there on April 6th. That means I would have been there for about 10 days around people that were infected. And they told me that I should get checked.
I hear you were told by a guard that these 3 guys were actually on your unit.
Yeah, I called in because I can call there and just talk to the people I know, right? They didn't say who, but there was a few inmates in my unit that got affected, yes.
Well, I guess the most important question right now is, how are you feeling?
I feel good right now. I just got tested this morning, so I'm hoping I'll get some results and I'll be able to hopefully get a negative test.
Okay, good. So we talked yesterday and you hadn't been testing. At that point, it sounded like it was a bit of a stressful process. So how did that work? Did it get expedited for you?
Last night, I got a call and they told me that they can test me this morning. So I took the first opportunity to get there and get it done.
Otherwise, you're symptom-free?
Yes, that's correct.
Is there anything that you think that these correctional institutions should be doing better?
Oh, absolutely. I don't think I've seen it firsthand. I mean, they had all the things they needed. Like, they could have easily gave all the correctional workers masks, or at least let the ones that want to wear them. They didn't do much screening for them coming in. They waited until this happened to take things the way they should have been taking it from day one, They absolutely could have did a lot more.
What's it like leaving prison and entering the world like this?
It's different. I mean, I could have never imagined a year ago when I was sitting there thinking about my release plans that this would have happened. I'm kind of used to being isolated. I spent the last year sitting around inside, not going out much, so I'm pretty good at it, I guess.
Okay. Well, Derrick, I really, really want to thank you for your time and for giving us a look into this really unique institution that a lot of people are concerned with. Thank you.
No problem.
Up next, we are speaking with Alyshah Hasham, the Star's courts reporter, who has been closely watching this story. Alyshah, thank you so much for joining us.
Happy to be here.
Alyshah, in one of our stories, we called the potential problems in prisons as part of something called the other pandemic, because it's not getting that much attention. I think part of this is right now we're really all worried about ourselves, but let's just start with why inmates and correctional staff are such a vulnerable population and why we should be concerned.
Yeah, so jails and prisons are, in the same way that long-term care homes are, these closed settings, and we know from what's been going on in the U.S. and in federal prisons here and in other closed settings that once COVID-19 is in these places, it spreads really, really fast. And jails and prisons are particularly vulnerable places because the people in there are already marginalized. Many of them have health problems, more so than general population. Some of those health problems weaken immune systems. People have addictions, mental health issues. So this is representation of Indigenous people. There's just a particularly vulnerable group in there already that is already likely more susceptible to being harmed by COVID-19.
At this moment, let's talk about sort of what's happening and what's happening closely. It sounds like the main issue here is the Ontario Correctional Institute in Brampton. We talked with Derrick, and he was just recently released from there. But can you give us sort of a sense of the scope of the issue and what's happened so far?
Yeah, so Derrick was released before they knew what was going on. Shortly, I believe, after the Easter long weekend, we learned that one correctional officer at OCI had tested positive. The next day, in sort of a weird flow of information, the mayor of Brampton announced late Wednesday night that, in fact, now 3 officers had tested positive. And we got confirmation from the province the next day about that. And then sort of things really escalated from there. Once they started testing and screening, doing temperature checks on inmates, it became clear that a lot of them were symptomatic, and some people may already be sort of at the end of their illness in some way. So we don't know when this outbreak really started, but it was able to spread to the institution really, really fast. So we can see how, to go from 1 to 3 to 60 is pretty dramatic. And this is by far the worst outbreak we've had in an Ontario jail. It seems to have been contained at the other jails so far. We've seen similar outbreaks at federal prisons across the country. So we know that OCI is a little different from normal jails. It's a lot more open, but we know that it can also spread in sort of more traditional prison settings as well. So I think it is a bit of a wake-up call, although people have been saying that this was a real possibility for a long time. But now we're actually seeing it happen.
What amazes me is at the beginning of this, a lot of the inmates were being told that they were safer on the inside.
Yeah, multiple people have told me that. Different people have told them that. I believe also Crowns have been saying that in court. But inmates have been saying to me and to other reporters that they haven't felt safe. Correctional officers as well. There's been a lot of concerns expressed around the use of PPE in certain situations and not being allowed, not enough proactive measures being taken, so temperature screening of people coming in and out, what's happening with inmates who are showing symptoms.
This is one of the things that we talked about and with Derrick, guards at first were being told that they were not to wear masks. An inmate was threatened with segregation for trying to wear gloves and being proactive. After it became clear that COVID had swept through the jail, they began isolating symptomatic inmates in segregation and providing them with face masks. What do you think that says about the response?
Yeah, I think it shows that maybe wasn't taken seriously enough from the start. It was only a couple of days before they realized it was in the institution that they were still eating together in the cafeteria. They were still playing sports together. They weren't getting food brought to their individual units. The union and correctional officers also put out a pretty strong statement about management not listening to what frontline workers were saying, the risk. So I think we've seen the result of not enough proactive measures being taken. It's pretty scary for a lot of people who work there and who are incarcerated there, and now who are in self-isolation or who are being treated at a different jail where essentially they've all been put in individual cells. And it's something that looks a little bit concerning in that it seems to resemble solitary confinement to an extent, but not being allowed out of their cells other than for very brief periods of time for showers, sometimes to make a phone call. But those conditions are also extremely concerning.
From talking to Derrick, the timeline at OCI just doesn't make sense. Most people on the outside were in lockdown by mid-March, but it sounds like the prison didn't really start to act until mid-April.
No, exactly. That timeline is pretty shocking, and it's absolutely something that should have been dealt with sooner. And that's something that inmates that I've spoken to. One inmate relatively early on said something that I found really shocking. He said, "I would rather be somewhere else and be in lockdown." No one wishes to be in a jail in lockdown, but he was so worried by all the different ways he was worried about getting it that's how he felt, because social distancing isn't really possible in a place like OCI. They share rooms, sort of a dorm style thing. So there's like maybe 6 guys with beds that are a couple feet apart. They share bathrooms, they share showers. They are responsible for disinfecting the stuff themselves. But I think the thing about being in jail or in prison is you don't have any control over your own environment, really. You're reliant on other things to keep you safe. And if you're not seeing those things happen, it's extremely scary.
It's not just the people in jails. The government has already released a lot of people early, like low-risk offenders. But the usual post-release support systems have also been disrupted, with all of the offices closed. One of the stories that you did that stuck with me was about a parolee who's currently in a halfway house where it is impossible for them to remain physically distant from the other people there.
Yeah, and in talking to him and talking to his family, it's just the frustration is so clear with this sort of bureaucratic system that is refusing to adapt to the really urgent needs that it's facing. And this is a problem that has always existed. A lot of the stuff that we're talking about are not really new issues. People have said sort of, there were all these cracks before, and now we're just really seeing those things break open almost entirely. They're not cracks anymore. Halfway houses are not designed to have social distancing. They're still controlled, closed spaces. You don't have the same kind of freedom of movement that you would have at your own home. And it seems like there's still an unwillingness to make sort of fair compromises for people who are low risk and are sort of ready to be released into the community. Their records and their information reflects that. So it's very difficult for people who are trying to make quick decisions because they're afraid about their immediate health, their immediate safety, but are being faced with a bureaucratic process that isn't matching that at all.
What are you hearing right now from frontline staff?
There's still on and off concerns around access to PPE. I think there's also some concern around kind of what proactive measures are being taken. I think for a while it seemed like jails were doing relatively well. The main issues were around making sure that people who had been recently arrested and were being brought into jail were being appropriately isolated to make sure that they wouldn't bring it into the institution. But looking at what happened at OCI, because OCI wasn't really accepting new people. It's not that kind of jail. It was guards bringing it in, essentially, unknowingly. So there's still a lot of concern about that. There was a staffing crisis that predates this, particularly at the Toronto South Detention Centre, which is now where the positive and non-positive inmates from OCI have been brought and are being looked after. And so obviously that is a concern, being able to look after more than 100 people who are presumed to either have COVID-19 or presumed to have it. It's a big challenge and one that jails and prisons were not equipped to deal with prior to this.
What do you think we should be watching out next with these institutions?
Yeah, there's a couple of things. One is around, so we've seen sort of the philosophy around how we approach long-term care change in terms of testing and things like that, because we're now seeing sort of if you test in some of these places, it shows up just because of the sort of really sort of sneaky way that this virus spreads. So I think we may be seeing a push towards more proactive measures to make sure that it hasn't gotten into institutions where we haven't seen any cases yet, to avoid sort of this cascade that we saw at OCI. The other thing is, I touched on this a little bit before, but the conditions in jails and prisons right now are harsher than usual given the frequent lockdowns. There have been complaints about lack of access to basic hygiene products, but also just, the fact that people are being held in self-isolation, which means you're alone in a cell. It's a little unclear exactly how things are working, but it sounds concerningly like solitary confinement or very, very restrictive confinement, which are things that courts have repeatedly condemned as being extremely damaging and dangerous to physical and psychological health. It's something that we have rules around. And so that's something that I think needs looking into, especially because we're going to be facing this for some time. And so it's really not a sustainable thing to just keep jails in sort of really, really harsh restrictive conditions for extremely long periods of time. And the last thing that I think is really important is being able to understand fully what's going on in these institutions, both in prisons and jails, where we've seen outbreaks. We don't have a lot of information about how badly people are being affected. So they mentioned this is a particularly vulnerable population. We don't know if they're experiencing more severe cases. We don't know if there have been how many hospital transfers there have been. All we know is that one federal inmate died in BC. But other than that, just there's been no release of that kind of information. And I think that is really important to know in order to gauge, again, just, how vulnerable and dangerous an outbreak is in these kinds of places. And I guess maybe just add one more thing. We've talked about how there have been releases at the provincial level and a lack of supports around that. But we're actually not seeing at the federal prison level any sort of change in releases of any kind concretely. So there's been no clearly articulated plan or data to show that more people are being released from federal prisons. And that is something that people have been demanding answers about for some time now. The need to depopulate prisons for nonviolent, low-risk offenders, people who are very close to being released, is something that advocates have been calling for as one way to make these places a little bit safer for both people inside and people who are able to safely leave and have places to go. It's been weeks and we still haven't gotten any answers from the federal government about that and whether that's happening and how that's happening. So that remains a concern.
Well, it sounds like there are a lot of them. Alyshah, I really want to thank you for your time today.
Thank you.
Alyshah Hasham is a courts reporter for the Toronto Star. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Raju Mudhar, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Foso. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.